Okay, can everyone see my slides?
Yes.
Okay, so study design. So first of all, okay, there is two types of study design, whether it's actually quantitative or a qualitative. So first of all, in terms of qualitative research, okay, in this research, the researcher decides what to do and what to study, and asks us very specific and also narrow questions, and collects, most of the time is actually numeric, yeah, whether it's actually continuous or categorical data from the participants, and analyze these numbers using a statistical analysis and conduct the inquiry in an unbiased objective manner. However, in a qualitative research, the researcher relies on the views of the participants. Usually they ask broad and also general questions, collect data consistently of the words or text from the participants, describes and also analyze these words from for the teams, and conduct the inquiry in a subjective manner or biased manner. So it's focused into a population, certain population. So in terms of research process for both these types of quantitative and qualitative research, first of all, in the quantitative, in terms of identifying the problems, is usually a descriptive and exploratory manner, explanatory manner. Whereas in the qualitative, is more of exploratory and understand more of in terms of phenomenon occur. Then in terms of reviewing literature, both is almost the same. However, in the quantitative, is a major role actually to see what is other studies doing, previous study doing. Yeah? And it's also justify the problem of what you want to study. In a qualitative, it's just a minor role, but still have a literature review to see what's the aspect or angle of studying a problem or the phenomenon, for example. Then in terms of study purpose, so in a quantitative is very specific and narrow, measurable or observable data. In terms of qualitative is very general and broad. Yeah, in terms of look at the participant experience, feeling, and expectation, and etc. Data collection in the quantitative is a predetermined tools using a numeric data, and it's usually involve a large numbers of sample. In the qualitative, it's actually general, emerging from the text, image, even a video, for example, and it's involved only a small number of participants. In terms of data analysis and interpretation, in the quantitative, because we use a numerical data, we need to analyze it using a statistical analysis method. And we usually describe of the trends, then we have a comparison and also prediction of the risk factors, etc. In terms of qualitative, it's actually more of test and analysis, and we present in a descriptive manner and in a teams, a focus in certain teams. Then it's usually giving a major meanings of findings. Then in terms of report and evaluation, in the quantitative is a standard and fixed objective, fixed, and the objective and so unbiased that we present. Right? But in the qualitative is a very flexible and it's actually emerging and it's reflexive and also biased. It's biased in terms of we cannot generalize it. Yeah? So it's focused into the specific population that we study. So in a quantitative design, and what is the use is actually can divide into two. It can be interventional research or non-interventional research. Under the interventional research, we is explaining whether an intervention influence an outcome for one group compared to another group. And this is actually a experimental study, or experimental research. In a non-interventional research, it's divided into two, whereas where we look at association or correlation of variables in a predictable pattern for one group of individuals, the research is actually correlational research. Whereas in the when we actually describing the trend for the population or study, is more of research, survey research. For the qualitative designs and its use, yeah, it actually can divide to three. When we explore the shared culture of a group of people, then the name of the research is ethnographic research. When we explore the common experience of individuals to develop a theory, then it's called grounded theory research. When we explore individual story to describe the lives of people, then we call this as a narrative research. So there is a combined designs, yeah. So combine both the quantitative and qualitative. When we combine qualitative and quantitative data to best understand and explain a research problem, then we call it as a mixed method research. Yeah, it can be explanatory or exploratory, depends on when or what is actually the method come first. Yeah. Then using quantitative and qualitative data for individuals to study problems that they face in their setting, then we call it as a action research. Both are mix of the quantitative and qualitative. Then we can also classify further, yeah, in this study design. Okay, if actually one or more group of participants are observed and their characteristics are recorded for analysis, then it's just a observational research. However, when it's actually involved an investigators, control and also maneuver control maneuver, and interest lies in the effect of the intervention on the participant, then it's actually a experimental research. It's just more of how we classify it. Then how about the research questions? Yeah? How about based on the questions to ask? Yeah? So when we would like to look at the distribution or prevalence of this disease or problems, then we call it actually descriptive research. We just want to know descriptively what is the distribution. Then if you want to look at the correlation between ecological factors and disease among the population, then we call it as a ecological correlations research. And if we want to look at the prevalence of disease, yeah, most of the time we do a cross-sectional research. Then if you want to look at association between the factors and disease, yeah, so we can also look this in the cross-sectional research. However, it's actually if we really want to look at the association between factors and disease, we actually should or would actually to do a case control research. When we want to look at the incident and relative risk of the disease among certain population, it's good to do a cohort research. Then if you want to do look at therapy or preventive methods useful or effectiveness to treat or prevent disease, then we do a interventional research. In terms of epidemiological research, yeah, there is divided into two, whether it's just observational research or experimental research. If just observational research, it can be just a descriptive research and also case report, case studies. Yeah, so case report and case studies that most of the time we do in the clinical setting, is just a descriptive research. We just describe about the case. Yeah. Then there is a ecological correlation research just now about how is actually the epidemiology of the problems of the disease. Yeah. Then if we want to do analytical research, yeah, to look at the epidemiology, but it's actually want to analyze it further, then we do a cross-sectional research, a case control or cohort. Then experimental research is actually a clinical trial. The case, let's look into in detail, case report or series. So in a case report and series, we just to identify the beginning or presence of an epidemic or surveillance data. Yeah, so sometimes we have a new case, just like now we have a pandemic COVID-19. So it's still new, although it's already second years, but still new. So there is so many things that we are still unsure. So we can actually produce a case report. then formulation of a new hypothesis from that case, yeah, then use analytical studies to identify possible causal factor from this new case. Then in terms of ecological correlation research, is involve collection of information about one or more characteristic of a clearly defined population and relating to the number of individuals that form the population. This generalization. Yeah? So the population may be defined according to geographical, geopolitical, and also time criteria. The most common is a cross-sectional study, yeah, examine the relationship between diseases and other variables of interest as they exist in a defined population at one particular time. Yeah, disease exposure and status are concurrently evaluated in one spot of time among the individuals in a population, conducted at one period of time or at one time, cross section. Yeah? So provide information regarding the prevalence of a disease. Normally tries to find association and not actually testing the hypothesis. Yeah, it's more of look at association. The hypothesis is more of the association. This is what usually we do in the cross-sectional study. So we look at the disease as in the column and also expose or exposure in the row. Then we actually do a chi-square and we look at the presence and absence of the disease. Yeah. And what is the research question in the cross-sectional study survey or research? Yeah, so we ask about what is the nature or magnitude of the problem, who is affected, how do the affected people behave, what do they know, believe, think about the problem. So we know very little about the problems and its possible causes because it's more of association. It may be repeated to measure changes over time, and it can be used to survey large population. However, usually it involves limited variables, and for the small survey, is actually unlimited. For in the cross-sectional, we can also do a cross-sectional comparative study, yeah, where we can put inside analytical study in the cross-sectional study design just now. And here we attempt to establish cause or risk factors for the certain problems. We mean that we want to look at the relation between obesity and also impact glucose tolerance, for example, level of cholesterol with the cardiovascular disease, for example, and etc. Okay, there is an advantage and a disadvantage of each of the study design. For cross-sectional study, the advantage is very cheap. That's why I said just now it's quite common to use this method because it's very cheap and also fast to do. You just look at the cross-sectional in one time. Then we also have a hypothesis generation inside it, and when we want to analyze it and compare and look at the association, and is able to generalize because usually we take a quite large sample. Yeah? Then we can actually use the prevalence for our planning and look at the disease load and also high risk population. And it's actually it can be used and most of the time can use as a baseline for the further study as a cohort study. Yeah. However, it has its own disadvantages. So, for example, it's just show association. It cannot really give you a causal effect or risk factors. Yeah. Then it also have a problem in terms of survivor's problem. Okay, and not for rare diseases. Rare diseases is more of case report and case series. Yeah, and it's also not for the remission. Okay? Then possible biases can occur in terms of selection and also misclassification. That's why in the cross-sectional study, we scrutinize in terms of how you select the sample, whether it's randomized or not, to ensure that your cross-sectional study findings actually can be generalized for the whole population. Okay? Next, case control. Yeah, in the case control, to identify the fact of a diseased and also non-diseased or affected or also non-affected subjects, and compare this specific characteristic to determine possible association or risk for disease. Yeah. So in the case of control, we have two groups. We have case group and we have a control group. Then we look at this in the case group, what is their positive factors and what is their negative factors. In the control group, we look at what is their positive factors and also uh, negative factors. Yeah, usually it's actually retrospective. Okay, so we look at what is actually the factors influence, yeah, to make that person to become a case. Yeah? Case selection, yeah, determine clear and reproducible definition of the health problems to be studied as much as possible, avoid misclassification of biases, yeah. And sources of cases can be all persons with the disease seen in a particular facilities, for example, HCTM, in a specific period of time. All persons with the disease found in the general population also can be used. The term is actually incident cases, newly diagnosed case. So that it can become our case. In terms of choice of control, control should ideally be selected from the same population give rise to the cases. That means the same population in that particular facilities, for example, or that particular population, for example. Yeah? It must have a similar to the cases in regard to the past potential exposure, so that it doesn't have biases. Yeah? That's why in the case control, we need to compare the case and control characteristic. And actually free from this control must be free from the study disease. If the controls are patient with other diseases, then only diseases that are not known to have relationship with factors under study will be selected. That's why in the case control, the inclusion and exclusion criteria is critical, yeah, to really shows there is no biases in terms of selecting the control. And in case control, we also do a matching. Yeah, this one is actually to take account for potentially confounding variables. Yeah, so we need to do a matching. What type of matching? Yeah, so first is actually frequency matching, selection of control with the same proportionate distribution of the particular variables at the cases. For example, we want to match the age and also gender, same amount, 35, for example. Then we can also do individual matching, pairing the controls with the cases on some common variables such as age, gender, and also ethnic group. So that means it's not necessarily numbers are the same, but they are almost the same age group, sex, and also ethnic group. So matched variables cannot be evaluated. Yeah, so in which that we just present as is actually matching, yeah, between the case and also control, but we are not actually analyze, yeah, it further. Then in terms of assessment of the exposure, so exposure should be assessed by the same method for both cases and also control. Yeah, so this called blinding. Yeah, so method of assessment. So available records, for example, hospital, vital signs, employment, etc. Yeah, okay, we also can do an interview and can do a self-administrated questionnaire and also can do a direct measurement. Okay. Comparability of the accuracy and completeness of the data is necessary. Yeah, that's why I mentioned just now. We need to actually match and also compare. Is a comparable, then only we actually compare this the finding of the causes or risk factors of both groups. Next, this one is the most big study, is a cohort study. Yeah, one or more individuals groups are defined based on whether exists or not the exposure to a disease factor. During the exposure status is defined, all subjects are free from the study design. So that means you follow up them, yeah, in the large manner. Yeah. Cohort study is normally prospective, exposure factors and also subsequently in the health effects are observed after the beginning of the study. Usually it's actually long-term study. Yeah? Other name for this type of study is actually longitudinal study because it's a long term. In the cohort study, we have the population. Then we look at the risk factors present and also absent in the population. Then when we follow up them, we see with these risk factors whether they develop a disease or not. And in terms of the non or absent risk factors, we also look whether they develop a disease or not. Yeah. So this is actually opposite to the case control. Yeah. Selection of cohorts, sources, of course, because it involves a population, so it's actually geographical defined groups. Yes, a special resource groups, say for example, among doctors or nurses, factory workers or population, and etc. There's a special exposure group, for example, then whether it's actually population that actually exposed to the radioactive, for example, or certain chemical like asbestos and benzene and etc. Then we have a comparison group similar in all respect except the exposure. So the population that's not exposed to the exposure or the no risk factors there. Assessment of the exposure and an outcome. Information on the exposure we need to record. And also look at the cohort members, and then we do a medical examination and measures of the environment. So this is the primary, usually it's been done as the primary assessment during the cohort. So we look at all these pre and post. Then information on the outcome. Then we have a periodic re-examination, that means the follow-up and surveillance of the disease ataupun surveillance of the death, hospitalization, clinic visit, and etc. So we follow up and see what is their outcome from that exposure. Next is experimental studies. This is actually quite common among clinicians, do an experimental study or interventional study. So education or assignment of individuals is under control of investigator and thus can be randomized. So investigator controls the assignment of the exposure or of the treatment, but otherwise symmetry of potential unknown confounders is maintained throughout the randomization. So in terms of randomization, there is a few more confounders that we actually not sure. That's why it's a try to be maintained. Properly executed, the experimental or intervention studies provide the strongest empirical evidence, and the randomization also provides a better foundation for statistical procedures that do observation than the observational study, because we intervene with a certain procedure and see what is the outcome. So in the experimental study, there is a randomized control clinical trial. So it's a prospective, analytical, experimental study using a primary data generated in the clinical environment. So individuals similar at the beginning are randomly allocated, they're randomized to 2 or more treatment groups, and the outcomes, the groups are compared after sufficient follow-up time with the intervention. The strongest evidence of the clinical efficacy of the prevention and also therapeutic procedures in the clinical setting. This is what we look at in the RCT. So it's it's actually repetitive, I think. Okay, next is a randomized control laboratory study. It's a prospective, analytical, experimental study using primary data generated in the laboratory environment. The difference is only this now is actually in the clinical setting. This one is actually laboratory setting. Laboratory studies are very powerful tool for doing basic research, because all extraneous factors other than those of the interest can be controlled or counted for. For example, age, gender, genetic, nutrition, and etc. Remember, yes, 2 days ago, Prof. Susanna presented her study. So actually, she's doing a laboratory study. It's actually certain thing was actually match, control, and etc. So that is a laboratory studies. Experimental study in terms of study population selection. Okay, so it's actually we look at the who is actually eligible to become our participant. We divide them into the eligible group and also non-eligible group. And in terms of eligible group, we look at whether they are become our participant or non-participant. How we select our participant is through the randomization. And this randomization then further actually divide them into the treatment group and also control group. Selection of subjects, we need to look at the numbers and also sources. Just now I mentioned about the inclusion and exclusion criteria. So what is the inclusion criteria we want to put inside our what we want to determine for our sample? So there is so many inclusion criteria and also exclusion criteria. Inclusion criteria by definition is what is the criteria that we want to select the participant, or the sample. But after we include them, what is the criteria for us to exclude them? So it's not a mirror between the inclusion and also exclusion. So that means when there is a lack of inclusion criteria, for example, maybe in the inclusion group just now, there is a pregnant women or lactated women, for example, or whatever the side effect and etc., then we exclude them. Next is terminology that we need to understand in the study design is randomization. I already mentioned a few times about the randomization. So it's actually a method for inducing comparability between the groups. So ensures that characteristic known or unknown did not influence the treatment assigned. So treatment given to the patient or next patient to enter the trial is determined purely by chance, not by any characteristic of the patient. We don't want to have biases in this study. That's why we do anonymization. And it allows the computation of the probability that the groups differ for both known and unknown characteristic. Does not guarantee perfect comparability. Of course, although we it's actually because we randomize, just draw lots, something like that. So it's not a guarantee, but we try our best actually to control the biases. So better than any known procedure, each patient enter the trials have an equal chance of receiving whichever therapy. So this now when we decide who actually goes to the interventional group, who's going to be a control, we do randomize that we have an equal chance to enter which group. Comparison group, to allow the evaluation of the outcomes of the interest in a comparable group of patients who receive a standard or best available relevant alternative treatment. For example, we maybe compare with treatment A and placebo, for example, or maybe treatment A with standard treatment. So the effect of treatment are compared to the effects of a control treatment. So comparability, the patient should not differ in any characteristic, known or unknown, relevant to the outcomes or the interest other than the treatment employed. So that's why at the beginning of the data presentation, we actually try to analyze between the case and control, with the treatment group and also a control, and to show actually is a comparable. They have a similar characteristic. So the p-value that we analyze in this comparability is supposed to be not significant. And if it's significant, we need to discuss what is our next finding, whether it's actually really significant or not. In terms of procedure, assign subjects to the treatment, interview or examine them. Then we do a method, have a method of assessment, how we want to assess them. And maybe we do laboratory studies in terms of the procedure outcome. And then we have a treatment schedules, number of units per visit, rules to changing dosage, for example, compliance checks, for example, with that treatment. And in fact, we also, one of our procedure in intervention is looking at the adverse reaction. We need to really have a definition of the adverse reaction, grade them, then inquiry and manage them well. This one is something is very important in terms of ethical. So we need to manage the adverse reaction or side effect of the treatment that we give to the patient, to the case and also to the case especially. Then we need to think about also a drops out. We need to define who is actually the participant that after the treatment, we want to actually drop them out from the study. And we can whether we actually exclude them or we actually handling them with and record them well and treat them as accordingly, and maybe we actually need to extend the study or not. So this is something need to be determined as a procedure in the experimental study. Blinding. So there is a 3 method of blinding. Single blind. In the single blind, either the patient or the physician knows the treatment which has been assigned. So most of the time, physician knows, but the patient does know about the treatment. So in a double blind, neither the patients nor the physician are aware of the treatment assigned. So that means only the investigators knows about the treatment assigned. Triple blind, even the statistician not aware of the assignment. So most of the time in the triple blind, only the producer of the item knows the treatment or the treatment of A, B, C, for example. So this patients don't know, physician don't know, even statistician who do analysis don't know which group is actually the treatment group. A, B, C. Then we do a follow-up schedule. So the schedule of visits, the duration of follow-up, for example, 15 minutes or 1 month, for example, measurement and also procedures to be conducted at each of the visit, to ensure that we want to analyze the pre and post and etc. And in a multi-center trial, the methodology of all measurements and procedures should be specified thoroughly, in which that HCTM, how is about the patients, how about the environment, how about the clinical setting, etc., etc. Then it is how we tabulate, for sample, 14 sample, for example, what is their visit, what is their examination, and etc. This is one of the examples. So in experimental studies, it also have its own advantages and also disadvantages. This is actually the best design for determining causal association and also evaluate program performance or treatment performance. However, it's actually have its disadvantages, exposed to selection bias, attrition, compliance, and also contamination bias. And it also have a very quite significant ethical implication. So whether we want to give the treatment or not to this another group, is it fair not giving the treatment to the control group? So there is a ethical implications. That's why in the randomized control trial or clinical trial, most of the time you need to present in the ethics committee. So the next one is actually quasi-experimental. In the quasi-experimental, it actually have some but not all of the characteristic of a true experiment. So most frequently missing is actually the random assignment of the subjects to the control and also experimental conditions. So example of the quasi-experimental research design are the natural experiment. There's something that actually using a natural phenomena, etc., where the natural has assigned subject to the two condition, or in a trend analysis. We are not really do a particular experiment, but actually the assignment of the group is actually depends on the natural environment or situation, etc. This one is actually added slides, because yesterday in my group, facilitation group, student asked me what is the difference between pre-test and also pilot study. In a pre-test study, it's actually a small-scale trial, a field testing of a particular research component. It means you want to pre-test the instruments, for example. You want to pre-test the questionnaire, for example. But in a pilot study, it's actually the process of carrying out a preliminary study, going through the entire procedure with a small sample. So it's still a full-blown study. Okay, it's still a design, sampling, all been done. Yeah, similar with the full study. Just that because it's actually something new, you are not sure what study design that you want to use, what actually sampling you want to use, and etc. etc. That's why you conduct a small sample. Yeah, with this some sort like your proposed study, and you determine whether it's suitable or not to proceed with the full study. Yeah, so that is a pilot study. Okay, I think that's all. Thank you very much. Any question?
Thank you very much, Dr. Azimatun. If the participants have any question, you can type in the chat.
In the question and answer.
Oh, sorry. Yeah, in the question and answer section. Salam, Dr. Azimatun. Can you elaborate more on quasi-study method? Thank you.
Okay, quasi-experimental study is actually also you have the intervention, just that you don't randomize the group. Okay, you don't. It's actually by the natural. It's actually been assigned into two group. Yeah, it can be how to okay, one of the experience kita cari example. Okay, sounds like we want to give them education. Yeah, we have two groups. Yeah, then we have we want to give them education. Yeah, but when we do give them education, sometimes we cannot actually really control in terms of education. Education can be actually given through media, social, and etc. Yeah, so then is we can't exactly control, divide them ataupun assign them into the experimental and also control group. Yeah, so that is actually is experimental, but it's not fully experimental. Yeah, so it's actually by nature they have also biases in terms of this selection of two group. Yeah, so that is about the quasi study method. Okay, how about retrospective study? Okay, retrospective study, I just said down in the case control is also a retrospective study. Yeah, another method of retrospective study is actually you use existing data. Yeah, for example, we in the hospital we have a huge data. We have a big data. Yeah, we have plenty of data. Yeah, and we want to actually look at the trend. Yeah, or we want to look at the in the 10 years back data, what is our trend of diseases occur. Yeah, and we want to actually explore further with all the data that we have in the hospital in that particular disease, for example. So that is also a retrospective data. You can do in the retrospective data, then a retrospective study like this, you can do many things. Yeah, you can do even a comparable study in using a retrospective data, retrospective study. Yeah? So just now I mentioned about case control. Yeah? So you, in the existing data, you can do many things with that data. If you can show the trend within 5 years, 10 years, and etc. Okay. You can also do a cross-sectional. Yeah, in the data when you look at the disease in this retrospectively, you can also do a cross-sectional, and you also can do a comparative cross-sectional, and you can do a case control. Depends how you actually select the case, select the control, and also select the study population. Vitro experimental study, does not involve human or animal. What is the study design of my research? It's laboratory study lah. Yeah. So and whether if it's actually laboratory experimental study. Yeah, vitro is actually a variable is actually experimental study. You follow up, you give treatment or whatever in vitrally. Yeah. So it's actually using a cell. There is a few students actually do a surgery, for example. Then they take the cells that they actually take out during the surgery, then they investigate further, and maybe they intervene, yeah, or do experiment to that cells. Yeah, that is a vitro experimental study. It's a laboratory experimental study.
Thank you, Dr. Azimatun. I just want to clarify regarding the last question about the in vitro experimental study. It's called laboratory study because the primary data comes from the lab research, right? That is why.
Yeah.
Okay, so it doesn't matter whether if it doesn't matter what the type of cells are, the samples are. It's because the primary data comes from the lab, right?
Yeah, there is also a procedure done in the lab. It's a experimental is actually done in the lab.
Okay. Okay, is there any other questions? Since we have a lot of extra time, feel free to ask Dr. Azimatun before she leaves us.
Yeah, if not, you need to catch me during the facilitation afternoon.
But you might be busy with the facilitating.
Yes,
So this is the time. This
yes.
is the time to ask.
Yeah. Any other questions? So this is something basic that we need to know about the study. Yeah. So before we conduct study. Okay, there is a question during my presentation is actually why certain study that suddenly when you send to the ethic committee, they ask you to convert into the pilot study. Yeah. So I already answered to my group that is actually sometimes when you do a full proposal, yeah, and in this full proposal, we found out that actually the study is very new and you don't have enough sample, yeah, to proceed with the full study. Yeah, so because it's clinical, we are limited with with the patients come to us with that particular disease, for example. Yeah, so that is also sometimes we say, oh, you can't do a full blown study because you don't have enough sample, and this is something new for you to try first. Yeah, to look what is actually the best design, the best method, and best sampling. Okay, so we suggest you to change from the full study in your proposal to the pilot study. May I ask why randomized clinical trial is not allowed to carry out at out-campus facilities? Oh, okay, this is something different topic. Okay, it's not really not allowed, yeah, but it's actually if you want to do a clinical trial in out-campus, it must be done by investigators in that particular facilities. Yeah, as a student, yeah, you actually need to more of in your own institution. Okay, that is a more of ethical issue and also permission and etc. Yeah, involved in this situation. Yeah, so as much as possible, if there is a multi-center study, each of the center need to have its own investigator as a collaborator in that particular study. So in out campus, yeah, so you do study in HUKM, then in your out campus facilities, you need to have the investigator there, the consultant there that will do the procedure. Yeah. So that's why actually it's not allowed, yeah, but it's actually have a certain things need to fulfill first before you actually can conduct it out campus. Okay, any other question? Any other question? Not in the chat. The question
So far there's
is none.
mm,
Okay. Apa tu? Sekejap. There is another one
yeah,
question.
I have two there. In the case of pandemic, do we need to adjust the sample size for clinical study?
Yes. Okay. If you are doing a clinical study and it's actually predicted to be actually some sort altered during this pandemic. For example, you are expected to be your sample will be smaller. Yeah, patient didn't turn up. For example, you need to adjust. Yeah. Certain things, certain measurement, for example, you cannot do. Yeah. So you need to adjust accordingly. So in the proposal, this current since last year, yeah, we will ask you, yeah, whether is it feasible for you to do this study during this pandemic. If you don't have enough sample, what you want to do? You need to think of what is your plan B if you don't have enough sample. Yeah, so that's something that you need to also adjust. Yeah, you cannot adjust sample size just like that. Yeah, because if your proposal is actually have already the design, etc., then you have already calculated the sample size that you need. If you adjust it just like that, it will affect your power of study. Yeah, so that's why you need to predict earlier and decide what is actually your study would like. Maybe you actually can reduce the variables, reduce what is the things that you measured, to reduce the sample size, for example, or what angle that you are looking at. Yeah, so you cannot maintain the same study, then you just reduce the sample size because of the pandemic. Of course, it can be happen, but your statistical analysis will not be good. Okay, it's not significantly significant, and you can't actually publish it. Yeah, so that's why you need to adjust it earlier. Yeah, and adjust when you, for example, you already done proposal is already approved, you need to look at your implementation of study to actually adjust it accordingly before you just reduce the sample size.
Dr. Azimatun, sorry, regarding that, that means when we adjust the sample size, that means the power of study will be affected as well, right? Am I
Yes,
right?
yes. That's why you need to look at the samples. That's why in the sample size calculation, we need to actually look at our objective. So when we have the sample size according to our objective, then when this our objective cannot be achieved because of the pandemic, we need to adjust the objective too. That's why we need to send back to the ethics committee, mention there is adjustment. Okay, there is adjustment in terms of objective, adjustment in terms of design, the adjustment of the sample size, and etc. And they most of the time we just approve because of the limitation of the pandemic.
Okay, shall we can focus on the question first? May I ask, should we predetermine the sampling first before decide the study design, or the other way around?
It's actually together. Okay, of course, you decide with the study design first. Yeah, but when you look at the when you decide the study design, yeah, then you look for the sampling. Yeah, then when you look at the sampling, then that's why in the sampling, before you decide the sampling, you need to actually recce what is your study population. Yeah, for example, you want to do a certain procedures, you need to know first, yeah, how many patient that you have in that particular disease. Then that's why I said it's actually come together. Yeah, sometimes you decide already the study design, but when you look at the study population in your hospital, it's actually not feasible to do. Okay, not enough. Yeah, for example, then you need to change your study design. So that is how. Yeah, as much as possible, try to decide the study design first. Okay, then look at the study population, then adjust accordingly. Most of the time is no problem unless actually you don't have any idea at all about your study population. That's the problem. Yeah, you must know about your study population. Yeah. If I
Sorry.
cannot get my sample size by the expected time due to pandemic, can I later do the study in KKM hospital and request for an MRR, which is not in the initial plan? Yes, that means you extend your study. Yeah, because the pandemic, you extend in terms of whether you extend the duration or you extend the location. Yeah, the facilities involved. Yeah. How to calculate sample size population when decide to do retrospective study. Okay, when you do a retrospective study, you already know your study population. Yeah. So because it's retrospective, you already know how many you have. Yeah. Then you decide your sampling sample size, sampling with the sample size that you already calculated. Yeah. So retrospective study is much easier for you to decide. Yeah. To do a sampling rather than prospective, because you are not sure how many is your study population, but you need to predict. Okay. What is your study population will be? How many?
Okay, there's a request asking for your email.
Yeah, if I'm mistaken, in my slides, in the thank you, there is a email, my email. Okay, Azimatun, all small letter, combine and at ppukm.ukm.edu.my.
Okay, there's a lost question in the chat. If I don't have enough sample size, can I take the rest of sample size from other hospital? I think you have answered that by saying that you can extend the place of the resource of sample kan tadi.
Yes.
Okay. Is there any other question? Final second. Any other question? Dr.
Yeah.
Azimatun, will you entertain if they have question? They forward their questions to your email.
Can. No problem.
Okay, then if there's no other question, I guess that's it.
Yeah.
For
Thank you very much.
today. Okay, thank you very much, Dr. Azimatun. Okay, participants, now we will have our break and we will resume back at 10:20 with the next topic. Okay, have a good break and see you later.